Thank you, Michael. Just a few comments that are going to sound very familiar because it's almost a repeat of what Michael just said, but the gratitude coming from Pete and Michael Peterson towards all of you who have been involved in what we believe is a wonderful effort that sets the, I think, stage for the really important work out in the field. So on behalf of Pete and Michael Peterson, the Peterson Center on Healthcare staff, we want to first thank Michael and the National Academy of Medicine team for your wonderful work. We were here when you were called the Institutes of Medicine, and we were here during the transition, and I know that transition had lots of backroom work that had to be done, and yet you stayed on top of this work as well, and we really appreciate what you've done. I want to thank Peter and the Planning Committee, and just second what Michael said. You know, it's one thing to assume a chair role, a committee role. It's quite another to be dogged about it and literally turn over every rock. And that's what this planning committee under your leadership, Peter, did. And we really want to thank you and express our gratitude. To the Bipartisan Policy Center and the Harvard School of Public Health, as our collaborating grantees, we want to thank Catherine Haynes and Ashish Shah for their openness, their willingness to say, of course we'd love to collaborate. Not sure we've ever done it this way before, but let's give it a go. And it could have been far, far different. And all the partners in this effort were very open to coordinating the effort from the beginning, and it made it very easy for us. We want to thank the collaborating foundations, SCAN, Hartford, RWJ, and especially the Commonwealth Fund. This effort had its genesis, frankly, in David Blumenthal's office, whereas the young know-nothing, me, at least in philanthropy, asked David what the Commonwealth Fund was doing in terms of high-need patients, what we were doing, and it looked like we were doing a lot of duplication of effort. And we were just about ready to initiate that effort and basically duplicate everything that the fund had already done, which is the worst thing you can do in philanthropy, is to use your benefactors' funds for something that doesn't have additional value. And it was David that said, well, maybe we can download what we funded to your effort. And I said, well, how about participating with us? And Melinda has been a terrific collaborator in that regard. And that started the process. And it started the process also with SCAN, who was already working with the BPC on a number of different things. And we all know that the Robert Wood Johnson Foundation has been in this effort with their national center now for a very long time. So thanks to you all. Just a few comments as the funder of this particular effort, and then we'll get to the really important work of the agenda. We really appreciate the fact that we've been included in the process as a partner as much as a funder. Now, it's important, that can get tricky in the sense that if we're going to be treated as a partner, we also need to know our limitations as a funder. In other words, we've got to let the process flow as this did. We couldn't come in with our own conceits, if you will, about what the result of this needed to be, other than to say it has to be better for patients, it has to be better for the clinicians and other health workers who care for the patients, and it's got to cost less. That was our only conceit. And we let the process flow. So there were a few things, though, beyond those three dimensions that were important to our effort that Michael's really already mentioned, but I'd like to repeat. One is collaboration. This is a very big issue. I mean, it's a huge, complex, messy issue. To think that we could drive something like this all by ourselves is the height of conceit. So we're very, very appreciative of the collaborative nature of this effort, and we expect it to continue because there's just the beginning. The report is just the beginning of the effort as we see it. Secondly, we believe that it's very important to stand on the shoulders of our predecessors, the previous work. And there's been wonderful previous work done in terms of the research, in terms of this segment of people that really, really need our help. Thirdly is the results need to be in such a form that they can be taken to the field. Don Goldman knows this phrase well. We worked with a person at IHI who respected publishing, but she said, you know, if that's all we do, all we're doing is spraying and praying, that it'll be taken up by the field. So our work is to take what has been developed here and understand what the features are, how to unpack those features, and replicate, and find partners in that replication. This is the most important element for us, and that's why I say this is a beginning, it's not an end. That this effort result in improvements in how people are cared for. And I think we can all agree that we can do a much better job in caring for people who need health and health care. Which leads me to my last comment. I want to personally thank Darcel Jackson and Veronique Humes Butler for their testimonials in our previous workshops. They gave us the stories, the inspiring stories of what they did as caregivers for people that they loved in their family. And it made it real, and it inspired all of us to cross those thresholds, roll over the rocks, which Peter and the planning committee did, and we have even higher thresholds that are inevitable to scale something like this on a national basis. And I know what I'll do is I'll remember these stories as the inspiration. So to Darcel and Veronique, thank you for inspiring us. So on that note, it's my privilege to introduce Jamila Hoy Rosas, the Director of Health Coaching and Clinical Partnerships for City HealthWorks, who's going to continue our tradition of starting with the patients. Jamila? Thank you.